Good morning and good afternoon to those of you on the East Coast, and welcome to today's webinar. My name is Jacob Borkover here with the webinar team at Rectangle Health, and thank you for taking time out of your day to be here with us. We are super excited for this 1 hour 1 CE credit presentation with Mr. Steve Anderson, Overcoming Your Patient's Toughest Financial Objections. So before we jump into things here, just a few quick housekeeping notes before we get started. So this is a 1 hour 1 CE credit course. We are accredited through AGD. This is subject code 550. So the CE credits will be issued through our AGD certification, but the subject matter in this will apply to all sorts of different types of practices. So it won't just be to dental. You will receive your CE credits via email sometime within the next 2 weeks. So be on the lookout for those. If you are joining today from mobile and you can get to a desktop, please do so. It is a better viewing experience and it will be easier for you to answer the polling questions. We will be having a survey prompted at the end of the presentation. I'm also going to be placing it in the chat. Please, please, please fill it out. It's super important for us to get feedback on how we're doing and learn more from you. So we are going to be picking 3 lucky survey respondents to win a $25 Amazon gift card. So maybe that'll be you. So please fill out that survey so you can help us continue to improve the experience. As I mentioned, there will be some polling questions. Those are required in order to receive CE. We got to make sure that you're paying attention. Nothing too challenging, but there will be 3 prompted throughout the course of the presentation. So make sure you are putting in those answers as you are prompted. And then our next webinar coming up is April 5th. It's a HIPAA and cybersecurity webinar. I'm going to put the link to register in the chat. So if you'd like to join us for that, it's a really great presentation with our Director of Compliance Solutions, Mr. Terry McDonald. So if you'd like to join us for that, please do so. And then if you have any questions today throughout the presentation, feel free to put them in the chat. I'll be monitoring, as will Steve, and we will try to get to your questions as soon as we can. I always get asked, are you going to be sending out the recording and slides? We will be. You'll be receiving that email before the end of the day today. Just note, if you have to pop off for whatever reason and you want to watch the recording, that's great. But the only way to get CE is if you're on for the duration of the presentation live. So if you have other staff members from your team that want to watch, that's great. Feel free to send it to them, but they can only get CE if they're here with us live. And then we will be getting those slides to you as well. So with that, I'm very excited to introduce our speaker today, Mr. Stephen J. Anderson. Steve has been named Dental Businessman of the Year by Excellence in Dentistry. He is a founder of the Total Services Patient Institute, Crown Council, and the Smiles for Life Foundation that has raised nearly $50 million for dental and children's charitable projects around the world. He's a great friend of ours here at Rectangle Health, and we're really excited to have you today. So Steve, with that, I'm going to send it into you.
Thanks, Jacob. Good to be with everybody today. Good day. And in the next few minutes together, we are going to solve one of the biggest challenges that we have in healthcare, which is dealing with patients' money. And so I'm going to get very, very specific with you. We're going to talk about some specific things you can add to your financial arrangement systems and protocols, as well as dealing with your patients' toughest financial objections. So when was the last time you heard one or more of these things from your patients as it had to do with treatment? I need to think about it. That's more than I was expecting. Won't my insurance cover it? Or my favorite, won't my insurance cover all of it because my insurance covers 100%? That's too much money. I can't do that right now. And the list goes on. So I'd like you to think about all of the financial related objections that you hear from your patients on a regular basis. And then here's my question, is you hear these on a regular basis. When was the last time you sat down as a team or as a business team and you talked about how to address your patients' financial objections? And if you're like most, it's been a minute since, if ever, since you've talked about what are the best responses to these types of questions, or comments. We're going to talk about the specific answers, and my challenge to you today is going to be not to just listen to what we talk about today, but sit down with your team and actually skill practice these, so that the next time they come up, like this afternoon, you'll be prepared to address these properly and turn them into not just obstacles, but opportunities for moving forward with treatment. So here's the truth about cost and the truth about money. I want you to think about the last thing that you purchased that you could not afford. We've all done it. We have all done it. Is you bought something that in any other circumstance you might have said, well, I can't really afford that. But you bought it anyway. So why did you do it? And the reality is that affordability for most things is not a matter of the quantity of money as much as it is our value system and what our priorities are at the moment. What are the priorities? When we have different experiences in life and different events, that can reorder our priorities, and then those priorities dictate the decisions that we make. So I'd like to suggest that when you hear these comments from your patients, that you ask yourself, what's their biggest priority? What is it that is most important to them? Because we are going to run our lives based on what's a priority for us right now. So financial arrangements luck. This is my favorite definition of luck, is when preparation meets opportunity. So when you've done the work to prepare, when the opportunity arises, then you're ready to handle the situation and deal with it effectively. So we're going to talk first about preparation, and then we're going to talk about how to handle patient financial objections. I want to build the foundation for you so that you have luck running in your way, that you've done your part, so that then you can have the best chance when financial objections come up of having a successful outcome. So let's talk about your financial arrangements toolbox for starters. So your toolbox represents the right tools and the right training. So what tools do you have to work with? And then what training have you had that prepares you to deal with money situations? All right, so here's the tools. There are 6 of them that I'm going to share with you here that you can add to your financial arrangements toolbox so you can be better prepared. So tool number 1 is what we call internal financial guidelines. So these are the guidelines that you have in your practice that give you the guardrails or the roadmap for how you do financial arrangements in your office. So it's not just up to anybody who happens to be doing it to do whatever they want. It outlines clearly how you do financial arrangements and how it works. So your internal financial guidelines should include your fees, right? What are your basic fees? And obviously you got a fee for everything. So it doesn't include every single fee, but it does give some guidance on how your fees are put together. Are you contracted? Are you fee for service? How you deal with the different types of payment systems that you have. Number 2, discounts. When do you give a discount, under what circumstances, and what are those discounts? So for example, some practices in different healthcare environments will give a 5% discount for paying for their treatment all up front. So let's say it's elective, they'll give a courtesy discount if they pay 100% of it up front. That's an example of something that would be in your financial guidelines. Do you give a senior discount? Any kind of discounts at all, family discounts, team member discounts, all of those discounts are outlined so that you do whatever's in your internal financial guidelines, but you don't go outside of that. Number 3 would be payment timing. So do you accept payment up front before the procedure begins? Do you allow payment after? Do you go ahead and do, in some healthcare environments, you go ahead and do the procedure, you bill it to insurance, and then the patient's responsible for the difference? So what are all the timing factors in your practice, and how does that work? Payment timing using insurance, we've talked about that. So how does insurance play into the game? We're going to talk a lot about insurance today. Payment options. So what are all the different ways that patients have to pay? Cash, credit card, check. What credit cards do you use? Third-party payment options, which is the next one. So what type of patient financing do you have available? So all of these things are in your internal financial guidelines. This is a document that's available to every team member so that everybody knows how financial arrangements are constructed, and they also know how to do it if they're part of the financial arrangements team. All right, so Jacob, we're gonna do the first poll. So does your practice have written internal financial guidelines? Let's go ahead and pop that up there. Everybody gets to vote. As Jacob mentioned, you get to take the quick poll, which is a requirement if you want continuing education. We need to know that you're alive.
All right, so we'll give everyone about 10 more seconds here, Steve, to get in their answers.
10 seconds to go. Everybody get to vote.
All right, it looks like 71% said yes, 29% said no.
Fantastic, very good. So for those of you if you don't have that in existence, I challenge you to go ahead and put that document together. If you do have it, congratulations. And it might be time, based on what we talked about today, to update it with some additional things and suggestions that we'll talk to you about today that will enhance your financial arrangement success. All right, next tool number 2 is what we call external financial guidelines. So this is the document that you typically refer to as your financial policy. So this is the one that the patient receives that they sign off on. I've got a little different take on that, which is we like to call it the financial relationship form. So instead of a policy, no one likes policies. This is more outlines what the relationship is, the financial relationship is between everybody that's involved. So for example, what's the financial relationship between you and the patient? What's the financial relationship between the patient and their insurance? And really critical, what's the relationship between you and your patient's insurance? So those are 3 different relationships, and this form then explains what that relationship is between all the parties. So here would be the word picture. Imagine that you have just invited a friend over for dinner, and the last thing that you would put in front of them is a list of policies for dinner. Here's our house policies for dinner. You'd never do that to a friend. So same thing is, our hope is, one of our companies is total patient service. So if you're inviting somebody into your healthcare home for the first time, I don't think you'd put a bunch of policies in front of them as much as you'd want them to understand what our relationship is between all of the financial parties that are involved. So this is a friendlier take on that form. It's the financial relationship, not the financial policy. And you explain all the different aspects of how that relationship works, including what your commitment is to them. So for example, one of the things that I love about this example is that the third bullet says our practice is committed to providing the best treatment for our patients. Fees are usual and customary for our area. You're responsible for payment of the agreed upon fee, regardless of any insurance company's arbitrary determination of usual and customary rates. You'll notice that I put the word arbitrary in there. In other words, I'm just outlining, it's like, yeah, this is your responsibility and you have benefits and that's great, and we'll help you maximize those benefits, and it is yours. Now, commensurate with that, I would say that it is also your responsibility to help me understand what that fee is up front. So in some healthcare environments, I know that's a challenge. I've been in some medical environments where there has been a financial policy form that says I'm responsible for, payment of whatever my insurance doesn't cover. And so my first question as a patient is, okay, what's the maximum? If my insurance doesn't cover anything, what's the fee? And rarely, if ever, does anybody know the fee. And so it does raise the question, if you're asking me to be responsible for paying the balance, whatever that is, but you can't tell me what that fee is going to be, that's a bit of a problem. So there's some things to work out here depending on what your environment is, if you're all elective, if insurance is involved, but it's a two-way street. You can't ask me to be responsible for paying everything if you're not going to tell me what the fee is. So it would be like walking into Target to go shopping and it says, you know, there's a big sign that says you're responsible for whatever you buy, obviously, but we don't have any price tags on anything, and you won't know until you check out, until you're fully checked out, and then you got to pay no matter what. Doesn't really make sense, right? So there's some work to do here in healthcare to align the financial relationship between the patient, the practice, and any insurance that's involved. So your financial relationship form, that's my challenge to you, is make it more patient friendly. Yes, they're policies. I don't like the word policy. It's a relationship. All right, third tool, if you're going to do effective financial arrangements, you got to have a treatment plan. Right? You got to know what the treatment is that has been recommended to the patient, and so that you know what to work with. And this is common sense, but we get in a lot of healthcare environments where time gets tight and things are moving pretty fast, and the treatment plan doesn't get to the financial coordinator fast enough, and the whole thing comes unraveled. So goes without saying, but it's got to be said, you got to have a treatment plan. And our recommendation here is that you have one treatment plan, not three, not a bunch of options. If you truly understand what your patient wants and why they want it, then as a team, you should be able to make a recommendation that fits their situation, so that then your financial team can then work out the financial arrangements for the plan that you've decided on. If you don't know what your patient wants, then you're shoveling out a lot of options. Like, well, you can do this, but if you want to save money, you can do that, or you can do this. And then it's a train wreck because the patient doesn't know which direction to go, and left to their own devices, they're going to go with the cheapest option because no one put the pieces together for them. So get to know your patient and what they want, what they're looking for, so you can make a solid recommendation for a plan that will help them accomplish what they want. And then the financial team can put together the financial arrangements for that plan that you've all agreed on. And we could spend, in fact, Jacob, we got to do a whole other webinar just on that one topic right there, because this is the biggest mistake we make in healthcare, is we don't spend enough time finding out what the patient wants, and then we just throw options at them, and they're so confused they don't know what to do. So one treatment plan. Number 4 is, if you're going to do financial arrangements, you need to know what the schedule is, because scheduling and financial arrangements usually go hand in hand. So in dentistry, it's what are the openings for the doctor and the hygienist. In other healthcare environments, what are the openings that you have moving forward, so that you can figure out the financial arrangements and get the treatment scheduled right away and move forward. Number 4 is, again, you got to know what your schedule is, including today's schedule, tomorrow's schedule. Urgency and financial arrangements are best friends. So the faster you can make it happen, the better. Number 5, payment options. So what are all the different ways that they have to pay? Make it easy. So here's the rule. The patient service rule is, make it easy for people to do what you want them to do. Make it easy. Make it hard for them to do what you don't want them to do. So if you want them to pay, make it easy for them to pay. So here's some examples of great payment solutions. right? So making it easy for patients to pay and making it easy to run as an office. So you want payment systems that are not burdensome from an administrative standpoint. You want easy payment systems that will not result in a large accounts receivable. If you got a big AR problem, you do not have a collections problem. You have a financial arrangements problem. Let me say that again. There is never an accounts receivable problem. That's a symptom of the real problem, which is a financial arrangements problem. So if your AR is out of control, then you need to go back and look at your payment systems, and you need to look at your financial arrangement systems and figure out how that needs to be fixed. Another good characteristic is it doesn't generate a lot of paper, right? With so many electronic solutions today, we should be able to do payment systems without generating a lot of paper. Make it easy for the patient, so easy to decide, easy options, and make sure that it generates patient loyalty, right? Just if you make it easy for them, they will make it easy for you. So here's some additional components. Does it create messaging? Do you have everything digital? Do you have a text to pay option, which makes it easy? So we know that today, 97% of text messages get a response within 3 minutes. Let me say that again. 97% of text messages get a response within 3 minutes. So do you have a text to pay option that makes it easy for patients to pay, where they can just click on a link, make their payment, they're done? Do you have flexible payment plans? So you have different options they can choose from. And do you have a card on file system where you can securely store their credit card for future payments? So you can just bill their card on file, and it has to be what's called PCI compliant. So you have to be able to, if you're going to store credit cards, it has to be done digitally in an encrypted platform. You cannot, let me repeat this, you cannot store them in your office. So and everyone has to be PCI compliant. So we got a couple of poll questions again on this one, Jacob. So here's the first one. Does your practice have a text to pay option? So Jacob will pull that poll up. Do you have a text to pay option? One of the easiest ways to pay today.
All right, we'll give everyone about 10 more seconds here. Okay, interesting. 40% yes and 60% no.
Well, all right, so opportunity there for improvement. Again, it's make it easy for them to do what you want them to do. So whether they're remote and they're at home and you're trying to collect their balance, or sitting right there at your front desk, you can text them the link, they can pay right there. It's one more aspect of great financial arrangements that makes it easy for patients to pay. We got another poll. Do you currently have a PCI compliant way to store credit card numbers? All right, so this would be, you can't store it on paper. While you're taking this quiz, I have a good friend of mine that runs a boutique men's clothing store. I was there the other day and he said, you want me to just run this on your card on file? And I said, yes, where is it? And he pulls out a sheet of paper that he had literally in a file. You can't do that, right? You cannot do that. So it has to be on an encrypted platform where no one on the team can even see the credit card number. All of that is secure, and that is now required by law, that you have to have what's called a PCI compliant way to store credit card numbers.
All right, Steve, we got 71% said yes, 29% said no.
Good. All right, so much better on that one. And for the 30% that do not have a PCI compliant way, it is time to get with the system on that one to make sure that you're properly handling credit cards. There is so much credit card fraud that goes on today, and all that the PCI compliant platform is there to protect you and to protect your patients. Third-party financing. So every practice should have third-party financing options. Now, there's a lot of options out in the marketplace. I've just put some options up here on the screen. Let me just give you a couple of recommendations. A great patient financing solution ought to have a very easy application, no hard pull on their credit, a rapid approval, so rapid response, very few declines, so it should be dialed into different types of patients and credit scores, and it should give your patients multiple payment plan offers, so different flexible options so they can choose what fits their situation the best. So any good patient financing program should have that. Every practice should have good patient financing in place from a third party. You don't want to do this yourself, but good third party payment options you can offer for patients that want that option. So there are some great examples of that. Rectangle Health, that is sponsoring the webinar today, has a great solution called Care Now, Pay Later that is built into their practice management bridge that has a lot of these solutions in it. Makes it really, really easy because it's tied into your practice management software, and it houses everything under one roof. So you'll have an opportunity here in just a few minutes. If you've never taken a demo of their practice management bridge, it just makes all of these things that much easier. All right, your next tool, you're gonna laugh at this one, but it's a nice pen. So if you've ever purchased a house and you went to the title company to close, if you're like me, my experience when I've done that is, I mean, there's a huge stack of papers you have to sign, and they always brought out a nice tray of very nice pens that they set down in front. All of them work, they have plenty of ink, and they're indicative of the decision that I'm making, right? So no Bic pens that, you know, have a flower on the end of them or a fork, or the pen you got from the auto repair shop down the street. You should have pens that are specifically set aside for signing financial arrangements. If you have anything physical that they have to sign on paper, a lot of these options now are digital, which is great. But anything that they have to sign for treatment acceptance or financial arrangements, give them something nice that they can use to sign off on that. Number 7 is the right place. So someplace quiet. And I'll say this, I'll just cut to the chase. The worst place for financial arrangements is at the front desk. The worst place. They're standing there at the end of their appointment. They're ready to get out the door. It's the worst place. So find a quiet place, whether that's chair side, if you can do it. In many states, that's legal. In some states, it's not. But someplace quiet, private, that you can have a conversation and help them arrive at the solution that they're looking for. So next is the correct verbal skills. Now, one of the things that the Total Patient Service Institute, we are big on words. Words matter because words create pictures in our mind, and those pictures then create emotional reactions. And emotion is what drives everything. We make decisions emotionally, and then we justify that emotional decision with logic. Even the one word can then change the whole emotional direction of a conversation. So let me give you some suggestions into minor word changes that will make a major difference in your financial arrangements outcome. So financial policy, we've already talked about this one. So we're going to change your financial policy to your financial relationship, especially on your form that it says financial relationship on the top, not financial policy. Nobody likes a policy. So financial relationship. Instead of your insurance coverage, it is your insurance savings. There's a lot of misconceptions about insurance. And one of those misconceptions is that insurance is supposed to cover everything. And the only type of insurance that covers everything is life insurance. It'll give you a big payout when you're gone, but everything else has limitations, right? So insurance in most environments, it helps us save money on our healthcare. So we prefer to refer to it as your insurance savings. Instead of saying your insurance will only cover, we say your estimated insurance savings. So let's say if I'm presenting financial arrangements or I'm the patient, you say to me, Mr. Anderson, the fee for your procedure is going to be $5,000. Your estimated savings is $2,500. And then here's estimated insurance savings. So it's savings. And then here's the next piece. Instead of your out of pocket, I hate that phrase. I mean, think about the word picture. If you tell me you're out of pocket, what do I visualize? I visualize empty pockets because you reached over and you just took everything out. So instead of your out of pocket, we say your portion. And if it's estimated, then we say your estimated portion. So your estimated insurance savings is this much, which leaves your estimated portion XYZ, whatever it is. So those are just some suggestions on the verbal skills front of commonly uttered phrases with a replacement of something that's far more effective than what we traditionally have said in healthcare. So let's talk about objections. So how do you handle, after laying the foundation, how do you handle your patient's objections? Here's an important differentiation. There's a difference between a condition for not moving ahead and an objection for not moving ahead. Let me explain the difference. So a condition is a reason for not moving ahead based on a current existing fact. So, for example, what would be a condition, a financial condition that might prevent somebody from moving ahead? Like they walk in today and you're presenting financial arrangements and they said, well, all of my money was on deposit at Silicon Valley Bank. Now, if you've been watching the news the last couple of days, the Federal Reserve took care of that, or not the Federal Reserve, but the federal government's taken, the FDIC took care of that. But if a currently existing fact is something that is factual at the moment that might be difficult to overcome. I just filed for bankruptcy, or whatever it is. There are very, very few things that are financial conditions that would not allow a patient to move forward. Most of them are financial objections. An objection is a reason for not moving ahead based on inadequate information, right? I just don't know enough to make a decision to move ahead. And most financial objections are exactly that. They're an objection, they just don't know enough, and we can help them understand so they can move forward. There are all kinds of different objections. There are basically 5 different categories of patient objections. They are those 5 things. Money, I put that on the top of the list because that's the topic of our webinar today. Lack of urgency, it's like, no big deal. I can do it tomorrow, the next day, or never. Time, maybe they have a time limitation. Trust, maybe they're questioning you, they don't trust the recommendation, or they're scared of something that has happened in the past or something that they're afraid of that might happen in the future. So those are the 5 basic categories. The reason I listed all of those is many times what gets presented as a money objection is not money. It's one of these other things. It might be a lack of urgency, a lack of time, a lack of trust, or they're scared. You don't know until you ask. All right, so here we go. Here are the most common financial objections and some suggestions on how to address them. Patient says that's way too much money. Okay, what does that mean? You have no clue. You have no idea what that means. So we have to find out. Now, I'm going to give you a quick trick here. This is a great financial arrangements and actually a great skill that you can use in any environment. If you'll hang with me here for just a minute, I'm gonna give you a PhD in the next 30 seconds. So you're about to get a bunch of letters behind your name. All right, so here it is. If you'll fold your arms, play along with me here for just a minute. Fold your arms. Now put your hand on your chin. Give me an all-knowing, wise look and say, tell me more. All right, so let's all do that together. 1, 2, 3. Tell me more. Okay, that's all a good psychologist does, right? They just keep, tell me more about that. Tell me more about that. Oh, time's up. We'll see you next week, right? So how do you eat? So if you don't know how to respond to a patient objection, then our recommendation is simply that, is simply ask, say, tell me more about that. So if I said to you, if I were the patient and I said, that's way too much money, then you would look at me and you'd say, you don't have to do the part. You say, tell me more about that, Steve. So I might, then you get closer to the truth, because then I'd say, well, I got 2 kids in college and the budget's really strapped right now. Okay, that's different. Budget is different than money, right? So what just happened quickly is that's a shift. I was thinking about total amount, and now we're talking about fitting it into your budget. So then if I respond to that, if you responded to me by saying with a question, if you said, all right, Mr. Anderson, if we had some options that we could work together to find a way to fit that into your monthly budget over a period of time, would that help? Okay, now what am I talking about? I'm talking about third-party financing, right? So I'm going to shift the thinking from too much money to spreading it out over time. Now, in our vernacular, that's what we call a BOTSOM, B-O-T-S-O-M, B-O-T-S-O-M, which stands for base of thought, state of mind. Base of thought, state of mind. If I can change your base of thought from all that money to fitting it into your budget over time, that changes my state of mind about the whole decision. So change my base of thought, you will change my state of mind. So that's way too much money. Tell me a little bit more about that. Well, I just, that's a lot to pay at one time. I don't think I can write you a check for, $2,000 today. Then your question in response is, I totally understand. If we could fit that into your monthly budget more comfortably, would that be something you'd like to take a look at, right? Answer with a question for the forward step. So BOTSOM, change their base of thought, you change their state of mind. All right, here's the next one. That's more than I was expecting. Now you might say, well, what's the difference? I can't afford it. That's too much money, or that's more than I was expecting. This one's different because of one word. And that word is expecting. So the element here is the element of surprise. There's emotion involved here. So I have to deal, here's the rule, is again, we make decisions emotionally and then we justify with logic. So if there is an emotional component, then I have to deal with the emotion first before I deal with the logic. So this one, it's not about the money, not yet. It's about the surprise and the expectation. We have to deal with that first before we deal with the logic of the finances. So if someone says that was more than I was expecting, then I would label that emotion and I would say, all right, Mr. Jones, it sounds like you got a surprise today. You came in expecting one thing and you got something different, whether it's treatment they weren't expecting, or they came in expecting that the procedure would cost one thing and it cost a lot more. Whatever it is, you have to deal with the surprise element. So you got a surprise today. Tell me about that. And then let them explain it. So they might say, well, this is what I thought it was going to cost. This is what it's ended up costing, or I didn't know I needed all this work, and now it was, whatever it is, it's the surprise. So deal with the emotion, and then say, I understand. You came in thinking one thing, and it's turned out to be something different. Then I'll ask another question, is I'll say, all right, so based on what we've talked about today, do you see where this is something that will, moving forward with this procedure, this treatment, that this will help you get what you want? In other words, I have to establish the fact they want the treatment, they want the procedure. Is, money aside, is this something, do you see this as something that'll help you accomplish the goals? If I know what our goals are, that helps. So for example, if I might say, so do you see this as an important way to help you accomplish your overall health goals that you shared with us when you came in? I want the yes to the treatment. Then here's the shift. Once we've established that, then I can say, okay, so then it sounds like what our job here together is to figure out a way to fit this into your budget. How can we make this work with your budget? Am I right? In other words, I'm getting a yes every step along the way. I'm not saying we have all kinds of different ways you can pay. No, I'm asking. So if we could if you and I can work together to fit this into your budget, would that help? Now, if they say no, it's just like, I'm not going to spend that kind of money. It's not worth it to me. That's a condition, because if they don't see where it fits, if they don't want the treatment, there's no amount of financial wizardry that is going to end in a yes. They gotta wanna, right? They have to want the treatment, and they have to see how it fits into their overall goals and objectives. So on this one, deal with the emotion and then deal with the logic, right? Deal with the surprise, and then you can talk about their budget and how to make that work. All right, here's the next one. I know you hear this a lot. Will my insurance cover all of that? Or how much will my insurance cover, right? It's all these insurance questions. All right, here's the key to this one. I love this one because it works so well. All right, so again, this is another BOTSOM, base of thought, state of mind. So I have to change their base of thought from my insurance is going to cover all of this to my insurance is a savings plan, right? It helps me save on the investment I'm making in my healthcare. So here's my question in return is I will say, all right, so Mrs. Jones, it sounds like you want to maximize your insurance savings so you can minimize your portion. Is that right? So that's my question. So Mrs. Jones, it sounds like you want to maximize your insurance savings so you can minimize your portion. Is that right? Then usually in our experience, that results in a yes. That's what people really want, is they want to maximize their insurance savings, not their insurance coverage, but their insurance savings. You know, maximize your insurance savings. So then I can say, based on what we know about your insurance that you have, your insurance benefits, we estimate, because it's always an estimate, we estimate your insurance savings as being whatever it is, which then leaves your portion XYZ, whatever it is. Now, provided that is the case, then would you be interested in looking at some options on how to take care of your portion? Again, question. I'm always asking questions. Questions are the answer. I'm getting a yes every step along the way, because if I launch into tell mode, 50% of the time, it will not result in a yes. I have to ask questions every step along the way to navigate my way to a yes for something that will fit their situation. So again, will your insurance cover, will my insurance cover this? Sounds like you want to maximize your insurance savings and minimize your portion. Am I right? We estimate your insurance savings as being XYZ, which leaves your portion this much. Would you be interested in looking at some options on how to fit that into your budget? Always asking. Maximize insurance savings, minimize their portion. Okay, this one's the toughest one of the lot. Let me think about it and I'll let you know. Here's my question to you. Do they ever think about it? I mean, when was the last time a patient called you back that was in 2 weeks ago and said, you know, I've been thinking about it and I've decided to move ahead? Every once in a while that'll happen, but not very often. Do we ever rethink about it? Nah, not much. You know why? Because thinking is the hardest work we do. As human beings, it's the hardest work we do. And most of us will do whatever we have to do to keep from having to think. We'll do whatever we got to do to avoid having to think. So they aren't going to think about it. And this is one of the hardest things to deal with. All right, so I'm going to give you the secret to this. If you can master this, you are the master of financial objections. So here's what we say. Grab your pen. Here we go. And I'm going to give you some resources here in just a second that'll help you master all these. But here's what we say. So if I were the patient and said, let me think about it and I'll let you know, here's what you would say to me. Is you'd say, Mr. Anderson, that's a great idea. A decision this important, you want to give it the proper amount of consideration, right? Give me some comfort of knowing, you know, it's important to think about. Then here's what you're going to say. Most patients tell me when they think about treatment like this, they think about one or more of three things. Do I really need it? Can I afford it? Or is it going to hurt? Now, what are the three? Do I really need it? Can I afford it? Or is it going to hurt? Now, Mr. Anderson, which one of those three things are you going to think about the most? Again, what are they? Do I really need it? Can I afford it? Or is it going to hurt? Now, depending on your medical specialty and what area of medicine you're in, those three things might be slightly different. So you can customize this to whatever your specific situation is. But in most healthcare environments, it's those three things. Do they really need it? Like right now, do I need to do it right now? Can I afford it? Right? Is it going to fit my budget? Or is there any pain or concern involved that you know is keeping me from doing it? Do I really need it? Can I afford it? Or is it going to hurt? Which one of those are you going to think about the most? In most cases, they'll pick one of those three. When you give them a choice of three things, they're going to choose one of those three things. So then they say, well, can I afford it? Right? So then what you could say is it the total amount or fitting it into your budget that's your biggest concern? Choice. So is it the total amount or fitting it into your budget that's your biggest concern? And if they say, well, the total amount, then I would again go back to the budget and say, all right, so if there were a way that we could comfortably fit this into your monthly budget, would that help you? And for most people, they're going to opt for yes. Yes, that'll help me. Great. Can I share with you the options that we have to help with your budget? Again, question, question, question. All right, so that's how we recommend dealing with the let me think about it. So again, most patients tell me when they think about this type of treatment, do I really need it? Can I afford it? Or is it going to hurt? Which one of those are you going to think about the most? Okay, here's the next one. I can't do it right now. Now, what does that mean? You have no clue what that means. It could be urgency, it could be timing, it could be a big family event, it could be I can't do it today or I can't do it this month. You don't know. So if you don't know, what do? Three-letter word, you ask. So what do you ask? Remember, be a good psychologist. You'd simply say, tell me about that. They say, I can't do it right now. Tell me a little bit more about that. Figure out what their story is and what their situation is, And then with the use of questions, you can navigate and find a solution. If it's a financial objection, then you can present financial options. If it's a timing question, you can make suggestions on how you can fit it into their schedule. But you gotta figure out what the situation is. Next one is, do I need to do it right now? So depending on what the procedure is, for some procedures, yeah, it's like, do I really need to do this right now, or can I wait? Can I wait? Do I really need to do this right now? So again, depending on what the procedure is, this might be applicable. So here's our suggestion on this one. And this is what we call a word picture. So a word picture is a picture that you paint with words that then helps them understand what direction or what choice they have. So here's the word picture. You would say to me, so Steve, let me ask you a question. In your life, when you have a decision to make, and if you know that something is going to happen in the future, you just don't know when. So for example, you know the hurricane is coming. You may not know the exact hour it's going to hit landfall. In your life, do you prefer crisis prevention or crisis management? In other words, do you prefer to manage, to prevent the crisis from doing the damage it's going to do, or just kind of wait till it shows up and then you'll deal with it? Now, most people believe in what? Crisis prevention. So then the answer, they say, well, crisis prevention. Say, great. So I can't tell you the exact moment when you need to do this. What I do know is it's not getting better on its own. It's only getting worse. The storm is coming. So would it make sense in this specific case? Let's do crisis prevention. Let's do it now on your terms, on our terms, instead of waiting and having to deal with it on its terms. Does that make sense? So crisis prevention versus crisis management. I'll give you a quick recommendation here for those of you that are in dentistry. This is a great crisis prevention tool that comes from Dental Warranty. So this is the only third-party warranty program in dentistry that creates peace of mind for any restoration that goes in the patient's mouth. And it covers that restoration for up to 6 years. If anything goes wrong with it, it has to be repaired or replaced, then the investment in that restoration is covered. So it's another peace of mind option for patients. So you can scan that QR code, and the folks at Dental Warranty will send you a peace of mind roadmap on how you can build more peace of mind, more prevention-oriented mindset with your patients. So grab your phone. I'm gonna have a couple more of these in just a minute. So grab your phone. We're down to the last 5 minutes here. I got a couple of resources for you here. So that's one. Here's the next one, which is, I need to talk to my spouse about it. I need to talk to my husband, my wife, my mother-in-law, my psychic about it. All right, so there's a number of different ways to handle it. Here's my favorite, is to say, I totally understand. That's what I call the Save Your Marriage plan. What do you think he or she will say? What do you think they'll say? In a lot of cases, they'll say, well, they'll probably say, you know, it's good. They just want to be involved in the decision. Or they might say, you know, they're really going to be freaked out about the cost of this. Or I don't know if they're going to go along with it. Whatever it is, you want to include them there. And let's find out what the biggest concern is. And then let's walk through how we might be able to say it. So for example, they might say, well, you know, I think they'll go along with it. I just want to extend the courtesy of letting them know what I want to do before I actually do it. So there's your in and say, all right, so would it make sense for us to go ahead and figure out the details now? Financial arrangements, scheduling. Then when you get home, in the unlikely event that there's a change, you can call me back and we can make some adjustments, right? But I want to know what they think will happen. All right, so those are the biggest financial objection. Now, you may have more. There's always more, but here's the key. A patient commitment meets these 4 requirements. You have agreed upon treatment. You have a signed financial agreement for how they're going to pay for it. You have a scheduled appointment, and you have a happy patient who's excited to have the treatment or the procedure done. Those are the hallmarks of great financial arrangements. That's what we're shooting for on every single patient. So here's a quick quiz. I'm going to run through 10 questions with you real quick. Your financial arrangements quiz, as it has to do with financial arrangements and objections. Here's the first one. Are your internal practice financial guidelines in writing? That was the first thing we talked about when we started. Number 2, is your financial relationship form patient friendly? We talked about that, making not a financial policy, but making it a financial relationship so they understand what everybody's relationship is with each other. Number 3, does your whole team know what your financial options are? Even the clinical team, do they understand what the payment options are and how you do financial arrangements in your practice? Do you present one treatment plan, not a bunch of treatment options, but the recommendation based on what the patient wants? Find out what they want. Number 5, do you train your team to respond to money objections? So we've given you some examples of the most frequent objections. Now train your team. You're going to skill practice those so everybody knows how to respond to them. Do you have your patient financing visible and available? So when you offer patient financing, is that visible in the practice so patients know that that is available? Do you present the office financial relationship form when presenting financial arrangements? So you present it again when you're going through the actual financial arrangements. You want to present that form again because it may have been a while since they signed off on it as a new patient. Do you have patients sign your financial arrangements because it is a financial agreement? Are you and your team, everybody on the team, confident in your clinical recommendations and what you charge for what you do? Do you have confidence in that? Do you believe it's worth it? Does everybody on the team think it's worth it? Because if you don't think what you charge is worth it, you're not going to come across as confident. You got to believe it. You got to believe in what you do. And finally, number 10 is, do you measure your results with regular accountability? So do you measure your financial arrangements success? So those are 10 hallmarks. Here's another resource for you. This is what we call a financial objections hack sheet. You can scan that QR code and download this sheet with your team to go over front and back of different financial objections and some of the recommendations that we've made today. You can skill practice that with your team. These are learned skills. Like everything else in healthcare, most everything in healthcare is learned. And good verbal skills for financial arrangements are a learned skill. So you can become a financial arrangements master and everybody in the practice along with you. So this is one resource that will help you do that. So everybody on the team can be on the same page and be able to handle your patient's financial objections like a master. So I hope those suggestions have helped today. And again, my challenge to you, take the hack sheet, take it back to your team, skill practice these. It's a learned skill that you can become and master those skills to present and handle your patient's biggest financial objections. Thanks for allowing me to share with you today, and a lot of luck to you as you work to build your financial arrangements skills. Jacob, back to you.
All right. Well, thank you, Steve, so much. Really great information from you there. And I think everyone learned a lot today about different ways they can bring some of this into their practices. So thank you again for presenting. With that, the CE is over. Before you pop off, everyone, just a few quick housekeeping notes here. I just posted in the chat a few links. One is the link to our next webinar. It's a HIPAA webinar on April 5th. Please register there. And then very important, We've got 2 other links there as well. One is the webinar survey. So if you look on your right-hand toolbar side, there's in the chat, you can click on webinar survey and then just open that up so you have it before you exit the webinar. Really important that you fill that out. And as mentioned before, we're going to pick 3 lucky people to win a $25 Amazon gift card. So please go in there on the right side and click that so that you can fill out that survey. And then the third link there is a link to schedule a demo with our team. As Steve mentioned, there's a lot of different components of a payment system that you should have, including text to pay, safely storing cards on file, patient financing. Through Rectangle Health, we offer that to more than 30,000 people. And we've got one of the best systems around. So make sure you're filling out that demo form so that we can get you scheduled and you have the most at your tool belt for your patients to pay. So very important there. And then I know everyone's in the chat always asking about CE. So CE, once again, will be sent within the next 2 weeks. Be on the lookout. Those CE credits are coming from our compliance arm called PCI HIPAA that sends out the CE. So be on the lookout for those within the next 2 weeks. And then as mentioned before, we will be sending out the recording and the slides so that you have it via email later today. You will be getting a follow-up call from our team. They're just going to check in, see how you like the webinar, and then see if they can help you out with implementing any payment systems for your practice. So with that, thank you again, Steve, for today's presentation. Everyone have a wonderful rest of your day, and we hope to see you soon at another webinar. So take care.
Thanks, Jacob. Thanks, everybody.
Bye, Steve.
Bye-bye.